Hello friends, welcome to Doc Tutorials interview session and happy to see again. This again has so much meaning to it because we are sitting with someone who has already secured his rank in INI and he has been placed in a prestigious institute, and that did not prevent him from securing a rank in NEET as well, and neither it stopped him from attending the NEET, and he had proven again just to make sure that his preparation has been good enough to get into all these exams, competitive exams. Hi Nehar, welcome
Yes, sir.
back, and congrats again for another rank of a similar category, top one and two.
Thank you so much, sir. First of all, I'm very, very proud to be here again and to be talking to you again.
Right. How does it feel at this point after two ranks?
So I'm very happy, and that is the first thing. And secondly, I'm very grateful to all the teachers, the faculty at Dr. Royals, my parents, and my colleagues who have helped me achieve this.
And I'll tell you straightforward, there is it is not that easy to do a consistent work and to be in the top even after exams, and that needs so much of one dedication, the preparation, and also some commitment to what you actually do, and that is what is expected not only in your exams but also during your DM program as well. Dedication in terms of your patient approach, dedication in terms of your empathy to the patient, all these are going to matter. So this is just a life learning, and one of the competitive exams trying to push you into one of the most favorite fields for you. And from my end, you do the same in terms of your dedication and your consistency across all your works, not only in your competitive exams, but for each patient is going to be an exam for you from now, and everyone is going to behave differently. It's not going to be a protocol which is written for everyone. Everyone is going to give you challenges, right? In terms of your, if I'm right, you're in an induction ward, so every induction
Yes,
is
sir.
going to be difficult, and you have to be on your toes, right? Every moment, we do not know who will kind of have a sudden febrile neutropenia, who will suddenly
Yes.
have a tumor lysis. So you have to balance your work, you will have to balance your life, and if there is anything else from your end also, you can take Nehar.
Uh, so nothing much from my end. So you have already covered everything which is important currently for me.
Right. So how does it feel for you to kind of face the patients now after getting? I know you have been into non-acad SRship priorly as well, and after getting into the academic SR, and how does it feel? Is that a difference, or how much learning do you think is still needed for you to get things more clear?
Sir, in for what I have realized currently, the patients, they don't behave as it's written in the books. Each patient, as you said, is different, and they will behave differently. And there are a lot of things in real life that we don't get prepared for just by reading, and like when to anticipate when the patient will get a reaction, when to prophylactically transfuse, when to think that you need to start chemotherapy, when to take a decision, like if the biopsy report hasn't come, or you have a provisional report and the patient is sick and he needs urgent chemotherapy, to give it or not. So these are the current borderline situations that they, like, even in Devita it is not clearly given, even in guidelines it is not clearly mentioned. So in real life, I feel that it is very important that one needs to get that clinical judgment correct. So that is one thing I
Exactly.
want to learn.
Exactly. So going forward, the decision making process is the learning process for you and all those who have cracked their exams. So it doesn't stop you from, thinking differently for each patient. And it is just a beginning that you have cracked your exams, and the real world is going to be after this. Guidelines are just to guide you to understand the concepts, but each patient is not going to exactly fall as in the trial which has happened for that cancer. And
Yes, sir.
just a note again, how did actually, I know you have been preparing even during your MD days, that actually adds on to the depth and the duration of preparation. So how does that help you if someone right on the first year or like what, second year into MD, if they are somehow clear as to they want medical oncology, for that matter, any super specialty, when do you want these people to start their super specialty preparation?
So ideally, if you are interested, I feel that for the first 2 years you should focus on patients in your MD. Read basics, get to know what is the bread and butter of each specialty. What do they see, and what to anticipate when you are working as a doctor there. And in the third year, if you are interested in a certain specialty, what I did is that I just read it in my in my free time. But again, I my main focus was on my doing my thesis and preparing for my MD final exam. But parallelly, I also read for medical oncology. And in the end, I feel that the major preparation, the serious part of the preparation, is what I did is after I was done with my MD exam. Like once I was post MD, because at that time, like my mind was a little free, and I could focus mainly on the mainly on medical oncology.
Exactly, something which he has brought out as a casual note. See, people tend to get interest into specialities, but even if they get into the interest, it is so important that you are doing your specialty well. Get to know the nooks and corners of all your specialty thought process and your theories and your practicals there, which is actually going to help you in your super specialty patient management as well. And more so for medical oncology, where there is no system preference or your organ based super specialty. It is just a chemotherapy protocol, and then the whole story, 80% of the story is all medicine management. So another take home point, people who are interested in preparation right during their specialty days, yes, do spare time as he told during the leisure time, but otherwise try and concentrate in your MD specialties, which will actually guide you into your super specialty as well. That is well taken, Nehar. And how did Dr. tutorials actually help you in all these stuff?
So I got the plan when I was in my in the end of my towards the end of my second year. But I did most of my studying in the third year, where I just went through all the videos once. I didn't try to remember the concept. I just made notes, and then I reviewed the doctor tutorials notes once I was done with my MD. So I had a basis to start on. And again in the so I made those notes, and I made notes out of them, and I went through them again and again. And the final days, what helped me especially, just 4 5 days before the exam, were the rapid revision videos. So I just saw them, and that helped keep my memory fresh for like the important exam topics and important exam questions, the high yield topics, just prior to the exam. So I was confident about that part.
True. As he has also again stressed upon, if you are interested during your MD days, just going through the videos, making some notes if it is possible, and then kind of revising or refreshing them after your MD completion, use so much confidence because you'll have some concepts already gone into the brain, and it is just a refreshing of the concepts and adding on to the updates as well. So that is also well taken from here. Mayor, all the best. Do well. Hoping to see you in any conferences and all other meetings of medical oncology. So do your job. Be compassionate to the patient. Be sticking to the protocols, and also treat every patient as if they are a new one for your learning. Thank you from
Yes,
my
sir,
end,
sure.
sir.
Thank you so much, sir.
Thank you. Thank you, Karthik.
Thank you.